start off this panel session. We all know what U equals U. As Dr. Nitaya mentioned, it's been around just up to nearly a decade. And so most of us in this room are fully aware of this. Is the undisputed scientific evidence that if a person living with HIV is taking treatment and sustains and maintains an undetectable viral load, there is zero risk of transmission. And the words that we use are very important. And, oh, sorry, we don't have, I just noticed that we don't have anything on the slides. Just give us a sec. If you can't, don't worry, you can just project it from your computer. So U equals to U essentially is largely applicable to only sexual transmission of HIV. And not other forms or methods of HIV transmission. I think so. Let's just give it a shot. And it moves. Fantastic. Thank you very much. So the science behind U equals to U is also very strong. It's embedded in a randomized controlled trial and 3 observational studies. Mainly the partner 1, partner 2, and the opposites attract. And this is some time now. But what essentially you can see from the slide essentially is that there are up to about 100, in the observational studies, they used up to about 126,000 condomless sexual acts where the partner was HIV positive and had an undetectable viral load. And the viral load threshold that they used here was about less than 200 copies per mil. And this is very important when you're providing the evidence, and the number is also very important because 126,000 condomless sexual acts is not a small number, right? So, I mean, if you cannot contract HIV from having 125,000 condomless sexual acts, that is a very strong message that you're passing, that you're giving across. And it's important to also note that that's level of confidence applied both to heterosexual and also to gay couples. And traditionally we're taught that STIs facilitate HIV transmission, but in the setting of U equals to U, STIs do not increase that risk of transmission. And then in IAS 2023 in Brisbane, there was a release of a WHO policy brief looking at the risk of sexual transmission in the setting of low-level viral loads. So we know undisputedly that there's no risk of HIV transmission when the viral load is less than 200 copies per mil. Okay, we've known that for some time. But the question is, what happens when your viral load is between 200 and 1,000 copies per mil? What was of interest to both researchers and people living with HIV was to understand the risk involved when the viral load was less than 1,000 copies per mil, because this is the value also at which WHO uses as a threshold to determine treatment failure. So this was a systematic review trying to attempt to answer that question, looking at 8 studies, 7,700 serodiscordant couples. Unsurprisingly, where the viral load was less than 200 copies per mil, there was no risk of transmission. So once again, zero risk of transmission. And amongst the studies where the viral load was less than 1,000 copies per mil, there were only 2 cases of transmission. And this was the most recent viral load, not the viral load at the time of transmission event. And in both cases, the viral load test was taken up to 50 days prior to the transmission event. Okay, and therefore the language or the way we communicate this is that between 200 and 1,000 copies per mil, there is negligible risk or almost zero risk of transmission, but it is not completely zero. This once again applies to largely sexual transmission of HIV and not transmission through injected drug use. And so WHO has come up with these 3 viral load thresholds: undetectable, suppressed, but less than 1,000 copies per mil, where there is a negligible risk of transmission, and more than 1,000 copies per mil, where there is a risk of transmission to your sexual partners. Now, looking at quality of life outcomes for people living with HIV, this was reported by a study called Positive Perspectives which is quite old now. It's a survey which was done in 2019, 2020, looking at patient-reported outcomes of people living with HIV, and this was specifically around communicating U equals U. And we know that from this study that about 35% of healthcare providers did not discuss U equals to U with their patients. And interestingly, discussions around U equals to U was not as prevalent in Asian countries as well as in heterosexual couples. But discussing U equals U has enormous benefits across a range of outcomes, be it overall health, mental health, sexual health, and viral suppression, unsurprisingly. So why discuss U equals to U with people living HIV? There are individual and public health benefits. Well, we know the answers to this. Well, it motivates, encourages initiation and adherence to antiretroviral therapy. From a sexual health point of view, it's such an important point of view, it removes the fear and the guilt around potential HIV transmission, enables sex without fear. And this is very important. People living with HIV from the beginning of the epidemic in the 1980s, particularly MSM, have always, a lot of the HIV prevention campaigns have always revolved around fear. So fear has always been very much part of the safe sex messaging in terms of HIV prevention. U equals to U has changed that completely. People living with HIV can now concentrating on what sex is meant to provide, which is essentially passion, joy, lust, mind-blowing, hot, rather than having always to worry about whether the sex is safe enough. It reduces HIV-related stigma at all levels. Unsurprisingly, also improves the mental and emotional well-being of people living with HIV, and in doing so improves the quality of life for people living with HIV. It removes barriers to testing, and from a clinician point of view, the enormous advantage that U equals to U has in terms of counseling serodiscordant heterosexual couples when it comes to conceiving. They can now conceive naturally. They do not need to be referred to all these complicating assisted reproduction methods, and this is very satisfying from a clinician's point of view. And it should and must affect laws around decriminalization in countries where this is an issue, where people have to disclose HIV and it affects their rights. But yet, and I've heard this many times alone in this meeting, is that healthcare providers still have that hesitancy about talking about U equals to U. And in a way you can't blame them, but the healthcare providers have been given more than enough time to really get their act together. And it largely centers around the discussion and the dissociation between condom in the setting of U equals to U. We know that in the setting of U equals to U, condoms are not required to prevent HIV transmission. But there are issues with some healthcare providers, admittedly, and concerns are mainly around sexual risk compensation. Because if you feel you're not going to get HIV in the setting of U equals to U, condoms do not play a part in preventing HIV transmission. They do play a part in other things, in preventing STIs, in preventing unintended pregnancies. And further, if we think that condoms equals to safe sex, U equals to U is in fact a much safer sex than condoms. And withholding U equals to U violates medical and sexual rights of people living with HIV. And often this is confusing, admittedly, because, you know, for the longest time, healthcare providers and people also in the NGO community have advised people living with HIV to use condoms again and again. But that was a time where condoms served as the only, or one of the only methods of HIV prevention. And we need to be aware of our own prejudices and stigmatizing attitudes towards key population when we disseminate the information around U equals U. So communicating U equals to U language ultimately matters. We've once again talked about this a couple of times during this meeting. We need to be clear, we need to be consistent, we need to use terminology which is not confusing when discussing this. So 0 equals 0 risk and no risk of sexual transmission. Admittedly, when I started communicating the U equals U message, I myself used words like negligible risk, virtually impossible. But with time and increased confidence, there was no problem in communicating that message very clearly. And we need to be confident about expressing that message. We need to be proactive about communicating that message. So we bring it up, we don't wait for patients to bring it up. And we do it at every point of patient's care, at the point of diagnosis, at the point of follow-up, at the time where they're wanting to talk about future children, at the point where they're failing treatment. There's not a single point of time where you can't bring up U equals to U. I discuss it at every consultation. And it's always important to mention and explain in detail the science behind U equals U. Because you can simplify it very easily, of course, to patients. When we look at healthcare-related quality of life measures, which are important to people living with HIV, as healthcare providers, we're very over-consumed with the physical aspects of health. That's how we're taught, so that's not unsurprising once again. So as healthcare providers, we're concerned about viral load, CD4 count measures, we're concerned about the physical aspects of health. But when you ask patients what really matter to them, of course these things matter to them, but there are other things which if we do not address, we are not providing holistic patient-centered care. And of that, important things such as social issues, such as isolation, intimacy, sex, are equally as important, if not even more important, than the physical aspects of the care of the patient. So when it comes to sex and HIV, what are the issues? Well, of course, it's the issues around disclosure, it's the role of embarrassment around having caught HIV through sex. And that is understandable that people find it very difficult to disclose their status with others. The lack of confidence that results with it, and the moral responsibility of knowing what to do and what is right to do. And of course, with the aging HIV population, sexual health issues also become equally important. So what is sexual health? Sexual health is not merely the absence of disease or dysfunction. It's not all about just screening and treatment of STIs. It is about sexuality and the strength of those sexual relationships and having pleasurable and safe sexual experience, free of coercion, discrimination, and violence. So what can we do as healthcare providers to ensure that our communications are stigma-free as possible? Well, we have to take a sexual history. But you can't just jump in and take a sexual history. You need to establish rapport initially, okay? And ask permission around having sex. And know your boundaries and know your environment. Know when to push, when not to push. And practice makes perfect. The emphasis should really be and move towards sexual relationships and pleasure and satisfaction as an integral part of sexual health, rather than just the absence or presence of STIs. Be sensitive and non-judgmental. Think about the body language that's being displayed by the patient. Be proactive. Initiate the U equals to U discussion. Communicate it in such that it's in a sex-positive way, concentrating on increased intimacy and having sex without fear, and how the perception of being undetectable has affected their sexual life. Be cultural sensitive. What works in the Philippines may not necessarily work in Malaysia. And if you get embarrassed when talking about sex, refer to someone who can do it, or get trained. But whatever you do, don't ignore the need to talk about sex. Have the condom talk, we'll talk about a bit more about that, and recognize that everybody has sexual needs, and in the right platform will want to discuss it. Just a reminder, in the context of U equals U, sex with a person living with HIV who has maintained an undetectable viral load constitutes safe sex, irrespective of whether condoms are used. And just to end, there are just a couple of examples I've given, not necessarily just revolving around sexual pleasure, but they're excellent resources that you can look out for healthcare providers. And this is a Can't Pass It On training for healthcare providers, which is an online module specifically around communicating that U equals to U. It's developed by Terence Higgins Trust, an extremely good resource. You can complete it at your own free time. It's a training module, and there's a multi-stakeholder involvement with experts who have been involved in the development of this. Vietnam has started, or was very early to really get their U=U movement going on. And one of the things that I wanted to point out is very early on, the messaging was very important to make sure that HIV was communicated in such a way that it was a celebration of love, of dream, of possibilities, rather than moving away from the traditional death sentence messaging of HIV. And now more closer to the Thai example of a national U=U training curriculum development. So what matters most to people living with HIV when communicating U=U messaging? And this will always work for most people. The strategies, as suggested by here, is to humanize the approach. Tell the stories of people living with HIV. They're a very strong message. Emphasize on what's important to them. And of course, de-medicalize it. Move it from a disease focus to a patient-centered approach in the way that you communicate, from correcting myths and misperceptions and destigmatizing the message. Ultimately, what matters to people when you communicate U=U is about living their life to the fullest, being relieved from sin, immorality, and irresponsibility, able to love and be loved, and enjoying intimacy and sex and pleasure. And these are themes that we need to communicate when talking about U=U, and then when we're scaling it up. So just to conclude, because the IS always like recommendations for efficiently communicating U=U at the end of their slides. Always explain the science, use clear and concise and unambiguous communication, be aware of our own prejudices. Always ask about sex and sexual relationships. If we're not asking about sex, you're not communicating the message as efficiently as you think you are. Be clear that the role of condoms, and we've mentioned this again and again in U=U messaging, is to prevent STIs and unintended pregnancy. It is unnecessary to prevent sexual transmission of HIV. But most importantly, it's time to reframe the HIV narrative with a focus on patient-centered values of intimacy and having the type of sex that people living with HIV want to have without fear or guilt. Thank you very much.